Picture enjoying a nutritious nut mix, but just one bite could increase the risk of liver damage by 48%. In the next 3 minutes, I'll guide you on identifying the right nut and highlight 4 that truly support your heart, bones, and brain health. That number comes from a 20-year study in the Journal of the American College of Cardiology. Stay tuned until the 3-minute mark, and you'll discover the harmful nut that many pantries conceal. Remain by my side. I'm ready to provide you with the comprehensive guide to the 4 incredible nuts that can safeguard your brain, bones, and heart. Additionally, I will disclose the 4 harmful nuts that you should consider limiting or avoiding entirely when making snack selections that could significantly impact your health. Many people share the belief that all nuts are the same. However, you could be seriously mistaken. Many older adults think they are making wise choices by opting for nuts instead of processed snacks. That instinct is indeed accurate, yet the reality is significantly more complex than many individuals understand. Inappropriate choices in nuts can lead to increased inflammation markers, disrupt blood sugar levels, and potentially interfere with medications. This isn't about removing nuts from your dietary regimen. It's essential to recognize which nuts can positively influence your body's aging process and which ones might hinder your health objectives on a daily basis. Engage with this so that more seniors can access it. This information could literally transform how you think about nutrition and help you maintain independence for years to come. Type "Nut Smart" in the comments if you're prepared to discover which 4 nuts should be included in your daily regimen. You'll also learn about the 4 that should be restricted or eliminated entirely to safeguard your cardiovascular, cognitive, and metabolic well-being. Many individuals overlook the connection between nuts and the aging process. These are more than mere snacks. These are potent formulations of substances that have the potential to either combat the effects of aging or hasten its progression. Research from Harvard indicates that older adults who choose the appropriate nuts exhibit improved cognitive function, enhanced bone strength, and more stable cardiovascular health. Many older adults are unaware of this concealed chance. The compounds found in specific nuts have the ability to penetrate the blood-brain barrier, offering protection against cognitive decline. These elements play a crucial role in safeguarding against the deterioration of bone density. They provide beneficial fats that maintain arterial flexibility. However, certain nuts have concealed carbohydrates that can elevate blood sugar levels. Certain substances contain toxins that can put a strain on the liver. Certain substances can exacerbate inflammatory conditions, leading to increased joint discomfort and cardiovascular issues. This explains why random nut consumption may not be beneficial for older adults. When your body is dealing with the natural changes of aging, every nutritional choice becomes more critical. Completely eliminating nuts is not the answer. It's crucial to identify the specific nuts that align with your health requirements and those that may hinder your journey towards maintaining health and independence. Good nut number 1, almonds. Here's why these should be prioritized in your daily regimen. Almonds have earned their reputation as one of the most complete plant-based foods, especially for older adults who need strong bones, clear arteries, and cellular protection. Every 1-ounce serving provides around 97 milligrams of calcium. That's approximately equivalent to a 1/4 cup of milk. This is crucial for individuals facing issues with bone density or striving to preserve their bone health as they grow older. However, calcium by itself is not the sole factor that distinguishes almonds from other nuts. Magnesium is essential for the effective absorption of calcium. This guarantees that calcium effectively reaches the bones rather than building up in soft tissues or arteries. Research from the National Osteoporosis Foundation indicates that this calcium-magnesium synergy enhances skeletal strength while maintaining cardiovascular safety. The antioxidant potency of almonds significantly enhances their value for seniors. The skins are rich in flavonoids that synergize with vitamin E. They form a powerful antioxidant shield. This combination aids in minimizing oxidative stress, a process associated with cellular aging, memory decline, and compromised immune function. The vitamin E found in almonds contributes to skin health and may play a role in maintaining memory function as we grow older. Almonds offer approximately 9 grams of beneficial monounsaturated fats per ounce, contributing positively to cardiovascular health. These fats play a crucial role in lowering LDL cholesterol levels while promoting the increase of HDL cholesterol. This contributes to the maintenance of healthy arteries and enhances overall cardiac function. Each serving provides approximately 3.5 grams of dietary fiber. This aids in maintaining digestive regularity and assists in managing cholesterol levels. Here's why they're regarded as the nut that supports cognitive health. Few foods resemble the organ they safeguard as distinctly as walnuts do. Their brain-like shape suggests their most significant role for older adults. 1 ounce of walnuts provides approximately 2.5 grams of alpha-linolenic acid. This type of omega-3 fatty acid is crucial for preserving the structure and flexibility of brain cell membranes. For older adults, these fats hold significant importance as they aid in facilitating communication between nerve cells. They offer a safeguard against the decline of neurological functions associated with aging. Research from Tufts University indicates that the omega-3 content in walnuts may support cognitive flexibility and processing speed in older adults. Walnuts are rich in polyphenols and vitamin E, both of which are known for their potent antioxidant effects. The polyphenols found in walnuts have a unique ability to cross the blood-brain barrier, setting them apart from many other antioxidants. This enables a direct reduction of inflammation within neural tissue. This is essential as persistent low-grade inflammation is increasingly acknowledged as a significant factor contributing to conditions such as Alzheimer's disease and cognitive deterioration. Walnuts offer a modest quantity of melatonin, a hormone essential for managing sleep-wake patterns. This may be beneficial for seniors experiencing difficulties with sleep disturbances. Sleep issues are a prevalent challenge that impacts cognitive clarity and general health. If you have found this information beneficial, please consider tapping the like button to assist others in discovering it. Your involvement ensures that this information reaches older adults who must grasp these essential dietary decisions. In just 60 seconds, you'll discover the often overlooked nut that helps balance blood pressure, along with a mineral powerhouse that demands careful portion control to prevent toxicity. Pistachios are an excellent choice for your nut selection. Here's why they serve as the essential regulator for your cardiovascular health. These unassuming green nuts might appear simple, yet their advantages for older individuals are significant. A 1-ounce serving provides a well-rounded combination of plant-derived protein, beneficial fats, and potent antioxidants. The calorie content is notably modest, sitting at around 160 per ounce. The high potassium content of pistachios makes them especially beneficial for older adults. Each serving contains approximately 285 milligrams. The elevated potassium to sodium ratio plays a crucial role in counteracting the blood pressure increasing effects associated with sodium intake. This holds particular significance for older individuals dealing with hypertension. Recent research featured in the American Journal of Clinical Nutrition reveals some intriguing findings. The intake of pistachios has been linked to significant decreases in systolic blood pressure levels. Pistachios provide distinct benefits for managing blood sugar levels, in addition to their cardiovascular advantages. The glycemic index is low for these items. These offer a beneficial combination of protein, fiber, and healthy fats. This combination aids in reducing the rate at which carbohydrates are absorbed during meals. This can help mitigate blood sugar spikes after meals. This positions them as an intelligent option for the considerable population of older adults dealing with type 2 diabetes or insulin resistance. Pistachios contribute positively to vision and brain health due to their rich content of lutein and zeaxanthin. These compounds serve to safeguard the macula. They could potentially lower the chances of developing age-related macular degeneration, which is the primary reason for vision impairment among older adults. Recent studies indicate that these compounds could contribute to preserving cognitive sharpness as one ages. Excellent choice. Brazil nuts. Here's why they are a thyroid and immunity enhancer that necessitates precise dosing. Brazil nuts provide unique benefits that are particularly advantageous for older adults. These are an exceptionally rich source of selenium. This trace mineral is crucial for activating thyroid hormones, supporting immune function, providing antioxidant defense, and protecting cognitive health. One large Brazil nut provides approximately 96 micrograms of selenium. This exceeds the daily recommended intake for the majority of older adults. This transforms them from mere snacks into therapeutic supplements encased in a natural exterior. Selenium plays a crucial role in the conversion of thyroid hormone T4 into its active form, T3. This governs metabolic processes, energy generation, and emotional well-being. It's important to consult with your healthcare provider about your nut choices if you are on thyroid, blood pressure, or statin medications. Thyroid issues tend to increase after the age of 60, particularly in women who have gone through menopause. Symptoms such as fatigue, weight gain, and forgetfulness frequently overlap, leading to common misdiagnoses. Incorporating Brazil nuts into your diet while being mindful of portion sizes could contribute to improved hormone regulation. In addition to their advantages for thyroid health, Brazil nuts play a role in supporting neurological resilience. Selenium plays a crucial role in safeguarding neurons against oxidative stress. Insufficient selenium levels have been linked to a heightened risk of cognitive decline. Research indicates that enhancing selenium levels could contribute to sharper cognitive function, improved memory, and more stable moods in older individuals. However, one must exercise caution with Brazil nuts. The selenium content that contributes to their strength can also pose risks when consumed in excess. Consuming more than 2 Brazil nuts daily may lead to selenium toxicity. Such conditions may lead to a variety of symptoms, including fatigue, gastrointestinal disturbances, brittle nails, hair loss, or nerve dysfunction. For the majority, consuming a single Brazil nut each day is adequate. Limit your intake to 1 Brazil nut daily and consider having 2 only on exceptional occasions. Incorporate 4 quality nuts into your daily routine. Now let's examine the 4 to restrict. Stick around. as grasping the 4 nuts to limit or avoid might be even more crucial than identifying the ones to incorporate. These forthcoming insights regarding concealed toxins, fluctuations in blood sugar levels, and interactions with medications have the potential to avert significant health issues that many seniors are often unaware of. It's time to examine the 4 nuts that may be subtly undermining your health initiatives. These foods aren't inherently bad. However, for older adults facing particular health issues or managing several medications, these nuts may pose significant risks that frequently surpass their possible advantages. Limit nut number 1: peanuts. Here's a risk that often goes overlooked by many individuals. Peanuts are widely enjoyed as a snack around the globe, yet for older adults, the health risks associated with them are often overlooked. In contrast to genuine tree nuts, peanuts are classified as legumes that develop beneath the soil. This renders them especially vulnerable to contamination by molds that generate aflatoxins. Aflatoxins are highly effective carcinogens that can lead to liver cell damage over an extended period. Even minimal ongoing exposure has been associated with liver issues and compromised immune response. Older adults face increased susceptibility to this concealed danger, particularly individuals with diminished liver function or impaired detoxification mechanisms, as highlighted by studies from the American Liver Foundation. Peanuts serve as a significant source of omega-6 fatty acids. Although omega-6 is not inherently harmful, an imbalance with omega-3 fatty acids can lead to increased systemic inflammation. This condition is associated with arthritis, cardiovascular issues, and a decrease in cognitive function. Many older individuals tend to intake excessive amounts of omega-6 through processed food sources. Peanuts contribute to this inflammatory load. Restrict the quantity of cashews. Here's why they are the often overlooked contributor to elevated blood sugar levels. In contrast to many other tree nuts, cashews contain a notable amount of carbohydrates. Each ounce provides around 9 grams of total carbohydrates, containing just about 1 gram of fiber. This increased net carb content can lead to a more rapid rise in blood sugar compared to other nuts. This poses significant risks for older adults dealing with prediabetes or diabetes. In addition to their effects on blood sugar levels, cashews pose potential concerns due to their oxalate levels. Oxalates are compounds that occur naturally and have the ability to bind with calcium within the digestive system. This results in the development of kidney stones in those who are predisposed. For older adults with reduced kidney function or a past of urinary stones, cashews may subtly increase existing risks. Restrict the intake of macadamia nuts. Here's why they can be overwhelming for your body. Although they might seem indulgent, for older adults, they often present more disadvantages than advantages. A significant issue is their high caloric density. A mere 10 to 12 macadamia nuts can contain approximately 200 calories, predominantly sourced from fat. However, they offer limited amounts of protein or fiber to promote a feeling of fullness. Macadamias are distinguished by their notably elevated levels of saturated fat compared to other widely eaten nuts. They consist of approximately 3 to 4 grams for every ounce. High consumption may lead to increased levels of LDL cholesterol. This may exacerbate pre-existing cardiovascular issues for older adults who are already overseeing their heart health or using medications such as statins. Their abundant fatty composition can also exert pressure on the gallbladder. Individuals with known or silent gallstones, a condition that tends to become more prevalent with age, may find that macadamias can provoke digestive flare-ups. Experiencing nausea, abdominal discomfort, or gallbladder attacks can occur after consuming fatty meals or snacks, particularly when larger quantities of macadamias are ingested. Restrict the quantity of nut number 4, which is pine nuts. Here's why they pose a risk of interfering with medication and creating aspiration hazards. While pine nuts may seem appealing, they present several notable drawbacks for older individuals. One of the most intriguing phenomena is pine mouth syndrome. In a time frame of 1 to 3 days post-consumption, certain individuals may experience a lingering, metallic, or bitter taste sensation. The duration of this condition may extend over several days or even weeks. This effect, although not physically harmful, can lead to a decrease in appetite and result in unintentional weight loss among seniors who are already at risk of undernourishment. It is important to note that pine nuts have compounds that could potentially interact with widely used medications. These encompass medications for blood pressure, antidepressants, and those aimed at lowering cholesterol levels. These interactions are not extensively covered in conventional guidelines. This poses significant risks for older adults who are handling various medications. Pine nuts pose a unique aspiration risk owing to their diminutive size and smooth texture. These nuts can pose a significant risk of accidental inhalation, particularly for older adults who may experience challenges with swallowing or suffer from dry mouth due to their medications. If inhaled, these small objects can obstruct air passages or become trapped in the lungs. This may result in aspiration pneumonia, a significant concern for older adults. Allow me to guide you through the practical application of this understanding. Review scheduled for Sunday. Begin by gathering almonds, walnuts, pistachios, and a single Brazil nut. Secondly, present nuts in a small ramekin rather than serving them directly from the bag. Third, store peanuts, cashews, macadamias, and pine nuts in a designated treat jar. To avoid rancidity, it's best to keep high-fat nuts such as walnuts and Brazil nuts in the refrigerator. Decomposed fats can transform advantageous substances into detrimental ones. When it comes to Brazil nuts, it's advisable to restrict your intake to 1 per day with a maximum of 2. Exceeding this amount may result in selenium toxicity. Findings from the American Heart Association reveal some positive insights. Older adults adhering to organized dietary recommendations tend to experience improved heart health results. They exhibit greater stability in their blood sugar levels. They exhibit enhanced cognitive performance in contrast to individuals who select food at random. Consistency is what truly matters, not the pursuit of perfection. It's advisable to consult with your healthcare provider regarding your nut selections, particularly if you are on medications for blood pressure, diabetes, or thyroid issues. Certain nuts may either boost or hinder the effectiveness of medications. Your healthcare provider can assist you in enhancing both your dietary choices and your therapeutic strategy. Understanding which nuts to select and which to steer clear of is essential for safeguarding your health. However, your overall dietary habits are your strongest asset for promoting healthy aging. Collaborate with your healthcare provider to develop a thorough nutrition strategy. Incorporate suitable nuts with other foods that promote bone health, enhance cardiovascular function, and boost cognitive performance. Regularly check your blood pressure, blood sugar, and cholesterol levels. This allows you to observe the impact of dietary modifications on your biomarkers. Focus on your energy levels, the quality of your sleep, and your mental clarity. These act as signs of how effectively your dietary selections are contributing to your overall well-being. The snack you choose today has the potential to enhance your vitality in later years, or it may subtly reverse years of dedication to your health. The decision lies within your reach. Nuts are potent foods that can significantly influence your health objectives depending on your selections and consumption methods. The distinction between flourishing in your later years and grappling with avoidable health issues frequently hinges on the informed choices you make regarding seemingly straightforward decisions, such as the types of nuts you choose to stock in your kitchen. You now possess the understanding to choose nuts that effectively promote your cardiovascular health, cognitive function, and general well-being. You're also aware of the ones that should be avoided or limited significantly. This guidance may assist you in preserving your autonomy and vigor for many years ahead. Type yes if you find today's advice beneficial. Hit subscribe and activate notifications to ensure the next guide tailored for seniors reaches you. Pass this information along to your adult children, grandchildren, neighbors, or friends who are looking to make knowledgeable food choices as they grow older. Your advice could serve as the crucial support they need to steer clear of dietary errors and enhance their overall well-being for the years to come. Remain vigilant, stay educated, and continue to make decisions that foster the dynamic, self-sufficient lifestyle you are entitled to. Keep in mind that this information serves an educational purpose and should not substitute for tailored medical guidance from qualified healthcare professionals who are familiar with your specific health situation. Pine nuts pose a unique aspiration risk owing to their diminutive size and slick texture. These nuts can be quite challenging to consume safely, particularly for older adults who may struggle with swallowing or experience dry mouth due to their medications. If inhaled, these small objects can obstruct air passages or become trapped in the lungs. This may result in aspiration pneumonia, a significant concern for older individuals. Allow me to guide you through the practical application of this understanding. Sunday evaluation. Begin by gathering almonds, walnuts, pistachios, and a single Brazil nut. Secondly, present nuts in a small ramekin, avoiding serving them directly from the bag. Third, store peanuts, cashews, macadamias, and pine nuts in a designated treat jar. To avoid rancidity, it's advisable to keep high-fat nuts such as walnuts and Brazil nuts in the refrigerator. Decomposed fats can transform advantageous substances into detrimental ones. When it comes to Brazil nuts, it's advisable to restrict your intake to 1 daily, with a maximum of 2. Exceeding this amount may result in selenium toxicity. Findings from the American Heart Association reveal some positive insights. Older adults adhering to organized dietary recommendations tend to experience improved cardiovascular health results. They exhibit greater stability in their blood sugar levels. They exhibit enhanced cognitive performance in comparison to individuals who select their food choices at random. Consistency is what truly matters, not the pursuit of perfection. It's advisable to consult with your healthcare provider regarding your nut selections, particularly if you are on medications for blood pressure, diabetes, or thyroid issues. Certain nuts may either boost or hinder the effectiveness of medications. Your healthcare provider can assist you in enhancing both your dietary choices and your therapeutic regimen. Understanding which nuts to select and which to steer clear of is essential for safeguarding your health. However, the broader patterns of your diet are your most effective strategy for promoting healthy aging. Collaborate with your healthcare provider to develop a thorough nutrition strategy. Incorporate suitable nuts with other foods that promote bone health, enhance cardiovascular function, and boost cognitive performance. Regularly check your blood pressure, blood sugar, and cholesterol levels. This allows you to observe the impact of dietary modifications on your biomarkers. Focus on energy levels, sleep quality, and mental clarity. These act as markers for assessing the effectiveness of your dietary selections in promoting your general well-being. The choice of today's snack can either enhance your vitality in later years or subtly reverse years of dedication to your health. The decision rests in your hands. Nuts are potent foods that can either enhance or hinder your health objectives based on your selection and consumption methods. The distinction between flourishing in your later years and facing avoidable health issues frequently hinges on making educated choices regarding seemingly straightforward decisions, such as which nuts to stock in your kitchen. You now possess the expertise to choose nuts that effectively promote your cardiovascular health, cognitive function, and overall wellness. You also recognize the ones that should be avoided or strictly limited. This guidance may assist you in preserving your autonomy and vigor for many years ahead. Type yes if you find today's advice beneficial. Hit subscribe and enable notifications to ensure the next guide tailored for seniors reaches you. Disseminate this information among your adult children, grandchildren, neighbors, or friends who seek to make knowledgeable dietary decisions as they grow older. Your advice could serve as the crucial support that enables them to sidestep dietary errors and foster a healthier future. Remain vigilant, stay knowledgeable, and continue to make decisions that foster the dynamic, self-sufficient life you are entitled to. It's important to keep in mind that this information serves an educational purpose and should not substitute for tailored medical guidance from qualified healthcare professionals who are familiar with your individual health situation.